Queen Alexandra Hospital in Cosham has unveiled its new CT scanner that can capture the image of a heart in roughly the amount of time it takes one to beat. The new Toshiba Aquilion 1 Vision scanner can also provide detailed pictures of a full chest in just 2 seconds. It's set to revolutionise treatment at the hospital as it reduces the time patients are required to lie in or under the scanner and the waiting time for the images to process. In addition, it is a much safer form of imaging to its predecessor, as CT and MRI Superintendent Radiographer for the hospital Nicola Ragg explained.
Well, it's a replacement scanner for a scanner that was 12 years old. We were very limited to what we could scan before because of the poor quality image that we produced because of the age of the scanner. So this is a much more advanced scanner. The technology is far superior, so the image quality is amazing. So we can now scan such more varied body parts than we could before. So it's opened up our scanning capabilities greatly. And the best thing as well, because of the advances in technology, the dose is much less. Because obviously with the CT scanner you're creating x-rays, so you're giving a dose of radiation. This is about a quarter of what we were giving before. So it's much better for patients, a lot less dose than before.
Last year, Portsmouth hospitals provided CT scans for nearly 60,000 patients. The improved speed and quality of imaging doesn't come cheap though, with an investment of around £1.2 million. But with a scanning process that has seen a step away from a clinical environment to a more relaxing, patient-friendly atmosphere, Nicola feels it's money well spent.
It's very expensive to buy a scanner like this, but for the patient experience it's so much better. It just means that for some of our cardiac work before we had to send it to other hospitals, we can now bring that back in-house so patients can actually have the right scan in the right place at the right time. So it's going to save us so much money in the long run. We've also thought of the whole patient pathway. What we decided, as well as having a new scanner, we wanted to make the environment much more patient-friendly. So what we've done is we've had a lovely artwork put on the wall, which is in a light box, so it's projected, and that was actually given to us by the League of Friends here within the hospital, and it just makes the room so much more inviting. It's much more patient-friendly. We've already had so much positive feedback of how it improves the room. It's not clinical anymore, it's so much more friendly and relaxing.
Ben Trepess, for That's Solent.